We own the former New Hope Recovery Center site, and then about a year and a half ago, we purchased what was the Youth Emergency Shelter building from the Youth Emergency Shelter. Right now at the Youth Emergency Shelter, we are providing what's called Level 3 DCS care for boys who are 13 to 18 that have either addiction and or mental illness. And then the Youth Emergency Shelter is still occupying basically the other half of the building. They have purchased a piece of property, a home near the airport, and their plans were to move out last December, and a few things have happened, and they've not been able to do that, but we understand that their move is imminent. When they move out, the state of Tennessee has expressed an interest to us to grow the service that we are providing in that building, which is residential care for teenage boys. So when they move out, very quickly thereafter, our service, our residential services will basically double, which means we're going to hire more master's prepared therapists and clinicians, more master's prepared case managers and counselors. So that's what's going on with the former Youth Emergency Shelter building.
What's the new building?
Yeah. Right now we are providing outpatient mental health services at the New Hope Recovery Center in a very small area, and that's for adults. And then we're providing outpatient mental health services for children, again in a very small space in one of the hallways at the Youth Emergency Shelter building. And we're just flat out of space. We have case managers who are using their cars as offices. We have 11 case managers that go out into the school system and in the community and work with our people, our adults and our children. And we have 2 seats for them at the Youth Emergency Shelter. So we're just flat out of space. We've only got a couple treatment rooms for children and a couple treatment rooms for adults. Whenever we build this new building, we'll have a wing with 6 to 7 rooms to treat adults, and a wing with 6 to 7 rooms to treat children. And we'll move all of our mental health services to this new building along with our case managers. The Youth Emergency Shelter site where we're doing our children's outpatient mental health work, that little space that we're using there, we'll need that space when we expand our residential services. And then the building that's on Main will go strictly for addiction treatment, which is its history, for both adults and for adolescents. So that's what that building will be used for.
Those 11 caseworkers currently, they're part of that 43 employees.
That's correct.
What do you project that to be 4 or 5 years?
That's a good question. The new facility will allow us to grow by at least 50% capacity, maybe even closer to 75% capacity. So we think that we're going to hire somewhere between 15 to 20 people in the next 2 to 3 to 4 years. That kind of range. That's our expectation.
Where do the operational funds come from? How are you going to maintain that?
Sure. The Helen Ross McNabb Center is a regional community mental health provider, which means we work out in the school systems, in the homes. We meet people out in the environment where they are. But we also meet people at our clinics with our prescribers and our nurses and our therapists. So what we do as far as our operations is contract with federal and state and local government to provide these services. You or I, some of us, go to our primary care doctor and we have a little bit of blood pressure issue or cholesterol issue. We can schedule that appointment. We can drive ourselves to the appointment, tell the doctor what's wrong. The doctor can take some quantitative empirical tests and tell us, this is what's wrong with you. Here's the medicine. Go get it filled and take it. Well, for our people that are severely and persistently mentally ill, they can't do that. So that's why we do both community-based mental health services as well as a clinic setting for those people. And we are paid through TennCare to do those services. About 40% of our revenue center-wide is from TennCare, and the remaining funds come from private philanthropy, from Medicare, from the state's safety net program. On the federal level, we receive some addiction treatment dollars from SAMHSA. So all of our operational dollars are pretty much contracted through either state, local, or government sources, insurance sources, or private philanthropy. I think at last count we had 102 unique funding sources center-wide. So we're an extremely diverse organization. So that's where the operational dollars come from. The organization is also completely debt-free, which I think is really important. Our history is to go out and raise monies privately from the community to build our facilities. And the reason for that is really twofold. First, TennCare and Medicare and all these grant dollars, there's no money there for facilities. That's why you see hospitals raising money for a cancer unit or a lung unit or a heart unit. Because insurance, by and large, does not have enough wiggle room, especially in the case of TennCare, to create funds for capital expansion. So we go into communities and we ask for support from those communities. The 14 buildings the McNabb Center owns and operates are all debt-free, and they're all results of fundraising efforts from the communities where we serve.
So it's operational support and continuation, it's not community. You're not depending on community.
No.
What about United Way? Are they still going to be asking? Is New Hope is asking for United Way money, or what?
That's right.
Still going to be United Way?
We are.
You are.
We are. We're a roughly $34–35 million organization. I think between all the United Ways across the 19-county area that we serve, I think our total is about $160,000 that we get from United Ways. So it's a percentage of our revenue, but it's a pretty small percentage of our revenue. So our primary revenue sources are going to be insurance-based payer sources.
And Houston, your group would own the building here, right?
That's correct. That's correct. And then the second part of why we raise monies for our buildings is that we really believe that in order to be successful, the community has to believe that we are essential. We know it because we've gone from serving about 150 people a year in 2008 to serving over 1,200 people a year in 2012. That's 4 years. Our anniversary is July 1st next week. So in 4 years, we've gone from 150 to 1,200. We've gone from 6 staff members to 43, and that number's going to grow pretty quickly when we build our new building and when we expand our residential services. The McNabb Center has invested money in this community. We have spent money to buy the Youth Emergency Shelter site from them. The McNabb Center is also putting $250,000 into this new building out of its operational fund. The other thing that I would say about the operational funding, Max, you asked that question. We're bringing about $4 million. Last year it was $3.5 million. This year it's going to be something like $4 million worth of revenue sources just into this community. And that helps us
From federal government, state.
TennCare, state,